Hello viewers, this is Dr. Sangeeta Datta, consultant psychiatrist, and today we shall discuss possession states. Possession state is a psychiatric problem or disorder where a person is possessed by a spirit or by God or by something else. The person believes that he is not the person that the world knows him as, but he is somebody else. Like he might say that I am Goddess Kali, or I have been possessed by Goddess Kali, or I have been possessed by Lord Shiva, or I have been possessed by a ghost, etc. Possession states are very common in India because in India it is a land of gods and goddesses. I must mention here that the symptomatology of different psychiatric disorders in India is very much influenced by the cultural beliefs of this country. Possession states by itself is a disorder. Usually it's a culture-based syndrome. Usually women suffer more from possession states as compared to men. And women, when they suffer from possession states, they become somebody who's very powerful, maybe a goddess, and now the rest of the people in the society start believing sometimes, especially in village areas, that she has some extraordinary powers. People believing this may actually come to her to see her activities and sometimes might come to even seek her blessings. So we must understand that in possession states, a lot is influenced by the belief systems and the cultural norms of India and Indian society. Apart from this, the woman who suffers from possession state is usually someone who has lived a very oppressed life. In other words, she has been a victim of maybe domination, control in her own family, and she has never been able to live her life the way she would love to live her life. That way, by actually becoming possessed by a goddess or maybe a ghost or something, she starts believing or showing to the world that she has the power which she was deprived of for an entire lifetime. Does she pretend in possession states? No, she does not pretend. But this entire phenomenon of being possessed happens at an unconscious and a subconscious level of the mind, which was described by Sigmund Freud. Possession states sometimes can also be a symptom or a sign of another psychiatric disorder or psychotic illness like schizophrenia or another psychosis, where a person believes that he is not himself but someone else. He has been possessed. That way there will be other symptoms. If it is a psychotic part of a psychosis, there will be other symptoms like poor sleep or suspiciousness, delusions, hallucinations, etc. In that case, we will not diagnose that as a possession state. We'll just consider it to be a form of psychosis. Sometimes possession state can be a culture-based syndrome. I have mentioned that, but sometimes it can even be a dissociative symptom or dissociative disorder. Like a person may not be completely aware of what is happening to her or him, but might actually, because of severe stress within the mind, she or he might sometimes dissociate into another identity or another entity and might function differently. That way the mind is more relaxed. She seems to be more in control. Such a patient seems to be more in control of her fate or her destiny, etc. Like I said earlier, usually people who are suppressed and oppressed suffer from possession states a lot. A lot of possession states is treated in Indian culture, especially in the rural areas, by traditional faith healers. And some of them manage to treat them because it's a psychological disorder through traditional healing. Sometimes because when a healer comes and reassures the person that, well, you'll be all right, your needs will be attended to. And sometimes because it's a psychological disorder, some amount of counseling from a traditional or faith healer also works. Sometimes traditional or faith healers also use medications, not necessarily allopathic, but from the Ayurveda or some natural medications which actually relieves the person of anxiety. That way also the person may actually come out of the possession states. But in psychiatry, I think I should say this, that especially so far as possession states are concerned or other culture-based syndromes are concerned, traditional healers or faith healers can work in liaison with psychiatrists. They can refer these patients to a psychiatrist And for a psychiatrist or a psychologist or a counselor, it's easier to diagnose a possession state per se, or a psychosis which shows possession as one of the symptoms, or as a dissociative disorder. Once it is diagnosed, treatment is easy. Treatment is again through medications and non-medical methods like non-pharmacological methods like counseling, psychotherapy, etc. So if you see a person who has been possessed, do not treat her differently. Do not be engrossed in superstitious beliefs. It is a psychological disorder. Please send her to a psychiatrist or a psychologist, and necessary interventions will be done, and this person will recover. And whatever led to the possession states, like the suppression and the oppression, can also be addressed through counseling the family members and making them aware of why the disorder happened and how to prevent a recurrence or a relapse. Please like this video or subscribe this video, and in the future we shall come back with a new topic. Till then, take care.